Welcome back to the NeuroVerse podcast. I'm Ali Ahmed, and today we're diving deeper into the world of autism, which is a topic that deserves greater awareness in our society. Today I'm thrilled to introduce our guest, Dr. Huck, who is a dedicated psychiatrist with extensive experience in working with psychiatric conditions in individuals. Dr. Huck's expertise and passion for supporting neurodiversity aligns perfectly with the mission that this podcast is promoting. So today we'll kind of discuss the nuances of autism and explore treatment methods and insights that can just empower families and communities alike. Let me just get right into the first question. So, could you explain the different ways autism can manifest in individuals?
Yes. Thank you for having me on.
Thank you for coming.
Yes, there are definitely everyone who has been diagnosed with autism or autism spectrum disorder, as it's now called. Um, there's no like cookie cutter recipe. Everyone has maybe basic aspects of the diagnosis, but not everyone has all of them. So,
Mm-hmm.
but more commonly, people who have autism spectrum disorder will basically have a few social inadequacies or difficulty interacting or making relationships or keeping relationships ongoing with other people. So oftentimes you'll see they may prefer to be alone or don't like large groups
Mm-hmm.
or like going out in public. Some of them are not able to communicate, so there's issues with speech, or they may not be able to necessarily express what they want to say or what they're trying to feel or what they're feeling, which can cause a lot of issues and frustration.
Yeah.
Um, More commonly, some of the first signs that we see with people with autism spectrum disorder would be, for example, poor eye contact.
Mm-hmm.
So that is actually one of the signs, especially when somebody who is autistic as a baby, they may not have those same interactions that another child may have with their parent,
Mm-hmm.
which is initially what leads to the suspicion of the diagnosis.
Yeah.
Um, a lot of times you may go to a store or you may go to the mall or like an arcade, and you may see that there's special timings for people with sensory issues.
Mm-hmm.
So at those times they'll keep the music down, or they'll turn down, or they won't let flashlights or whatever it might be. So there's a lot of sensory issues as well that some of these patients or people dealing with this diagnosis may have to deal with. Um, it's just that their speech oftentimes is different than regular. So
Yeah.
they may speak in a very monotonous way or a robotic way. They may also um, some of them are extremely intelligent, and
Mm-hmm.
uh, when they talk, when they speak, a lot of these kids may not come off as quote unquote normal. So they may deal with challenges of being made fun of, or have issues of being abused at school or whatever it might be
Mm-hmm.
because of these differences.
Yeah. Okay. All right. Thank you. That's very interesting. So moving on to the second one, kind of like bridging onto that, what are some common misconceptions, if any, about autism that you may encounter?
So a lot of times people think that if you're autistic, you're intellectually disabled. So intellectually disabled in the past, when I grew up,
Mm-hmm.
that was another word was that for that was like mental retardation or mentally retarded. That is not the right term. It wasn't then and it isn't now, but now we
Mm-hmm.
use the term intellectual disability.
Okay.
So uh, that is graded by IQ. So just because somebody may have a diagnosis of autism, it doesn't necessarily mean that they're intellectually disabled. They actually might be quite the opposite, where they're quite intelligent and are high functioning. So I think that's the pretty much that's the biggest misconception that people might have of the diagnosis,
Yeah.
is that they are lacking in the intellect department.
Mm-hmm.
Also, people. may say, "Oh, that person is autistic, so they're disabled, physically disabled or challenged." That
Yeah.
also is not always the case. So there's a stigma that comes with the diagnosis of autism, and I think that's pretty much the biggest misconception.
Yeah. Yeah. So what's the main way, or how do you differentiate between autism and other like developmental disorders?
Okay, well, some developmental disorders are very obvious. For example,
Uh-huh.
cerebral palsy is a developmental disorder. Some people even classify ADD or ADHD as a developmental disorder. So, I mean, there's some ways to there's some are very obvious, and you can say, okay, this is not what we're dealing with. Um, but some are more difficult to pick apart. So, if somebody has a speech impediment, for example,
Mm-hmm.
some may call that a developmental disorder. So, uh, just because you have a speech issue doesn't necessarily mean that you're autistic, and vice
Yeah.
versa. Just because you're autistic doesn't mean you have a speech issue. So there are ways to differentiate. Developmental disorders is a broad category.
Yeah.
Autism spectrum disorder, it is increasing in the incidence. So that means the more people are being diagnosed,
Mm.
and I don't think that's because more people are being born with autism. I think it's just we have better tools to be able to uh, assess it and diagnose it and recognize it.
Mm. Well, I actually didn't know that last part you shared. That's actually very interesting. So at what age do you like recommend for parents to have their children, like properly diagnose or go through the screening process for autism, and like why that age in particular or that age group?
Yeah, so that's a good question. I would say as early as possible. So
Yeah.
uh, I don't think there's any way to assess it as a young baby, but if a parent is noticing that, loud noises are causing trouble, or the baby is not looking at them in the eyes, or not smiling, these are all very, strong indicators that this may be the diagnosis. So um, I would usually they check these things at pediatrician visits. Like they'll assess these things. They'll look at um, uh, they'll do different tests like hearing and things of that nature. And the earlier you can catch this diagnosis, the better, because the earlier the diagnosis, that means the earlier you can start therapy, which is essentially the best and the strongest therapy or treatment for the diagnosis of autism spectrum.
Yeah.
So the earlier the better, because that means the earlier we can catch it, the earlier we can treat it, which leads to better outcomes.
Right. Right. Okay. Yeah. Um, so I know you just kind of brush on this a little bit, but what are the most effective treatment options that are like currently available for individuals with autism? I know you said therapy, but can you kind of go into that a little more?
Yes, therapy. So they're going to have speech therapy. You're going to have functional therapy, like to be able to teach them how to deal with certain situations. You're going to help them with emotional regulation, help them express themselves in better ways. So there's several. Most of the large cities have dedicated therapy centers specifically designed for the diagnosis of autism.
Mm.
Um, there are several just in like a 10-mile radius of where I live in Texas.
Mm-hmm.
So there, uh, it really depends on the person. So some people don't need a lot, and some people need very extensive therapy. Some people are okay with once a week. Some people need 3 times a week. Some people need 5 times a week. Some people need once a month. So everyone's a little bit different, but um, within the category of therapy, there are several uh, sub layers of therapy that can be recommended and be provided for the patient.
Okay. Okay. Thank you. So kind of like from a more like medicinal side of this, how important would you say like medication is in the treatment of autism, and is it even important at all?
Yes, I think it's very important. But
Hmm.
again, it depends on what the severity is. So, um, there can be, since there used to break it down. So it used to be autism, then there's Asperger's. There's
Yeah.
several different sublayers. Now they just call it spectrum. So you can be from the high end of the spectrum to the low end of the spectrum, and depending on how severe your symptoms are, that's what we need to treat. So we, as psychiatrists, will use well, and another. Let me backtrack for a second. Some of them may have other comorbid diagnoses. So they may have depression, they may have schizophrenia, bipolar, just like everybody else in the world. So medications are going to be even that much more important. So,
Yeah.
but for the emotional regulation part, a lot of times we will add like a mood stabilizer. So, um, for example, somebody may use a medication called Depakote, which is a medication we use for mood stabilization, but it
Hmm.
can also be used for seizures and other things. So, medications is not going to cure anything,
Yeah.
but can definitely help them function better and with their families and with their friends.
Okay. And
So that would be
oh
one
yeah.
example, but there's several others that can be used. A lot of times they'll have ADHD, so we treat the ADHD or impulsivity. We'll use things like clonidine or other mood stabilizers that are actually antipsychotics. They're called antipsychotics, but that's not all they're used for.
Mm.
For example, Abilify. So there's several treatment options out there, but the person would have to see a psychiatrist, and oftentimes even a pediatrician can start off with medication recommendations and go from there.
Okay. And you mentioned this earlier about like how it used to be like several levels of autism, but it's now just autism spectrum disorder. So
Yes,
so Asperger's, would you technically that is considered within the spectrum, but no longer is its own diagnosis?
that's correct. Yes. So there's a lot of people, high functioning people that were always called Asperger's,
Mm.
and now they don't label it anymore. Now, just like you said, they just change it to ASD or Autism Spectrum Disorder.
Okay.
But yes, definitely there's a lot of people around and walking around this world, you know, in our schools, at work. Um,
Hmm. I think I lost you for a second.
living a normal life, and but yeah, that's the uh, but yes, now is no longer more specific. It's just the broader umbrella of autism spectrum.
Okay. Interesting. Um, so kind of like more about the therapy aspect. How important would you say, like apart from like medical professionals, how important is like our family is like one's family and caregivers? How important are they in like the whole treatment process and just the overall process with autism spectrum disorder?
I would say they would maybe even be the most important
Mm.
part of it because they are the ones, the families, the caretakers, are going to be the ones that are with that child or that individual, day in day out from morning to night. So, if there's, for example, if there's a parent who is gets frustrated or doesn't understand the diagnosis, then that they're not going to be able to handle a situation when it comes about. They won't know what to say or what to do. So, and that can make things pretty bad. And but um, if they are well equipped to be able to handle these situations, sometimes families will attend these therapies or kind of um, do their own therapies to understand how to cope with this
Hmm.
diagnosis. But I would say they are the most important part of this treatment because um, their ability to um, interpret and handle and cool the situation that may be taking place. For example, a meltdown at the local grocery store or something.
Yeah.
If they freak out too, and the person's having their meltdown, things can go really well. But if one person stays calm and collected and understands what's happening, then that can easily remedy the situation And yes, extremely important for family and caregivers to understand what's going on. Extremely important for teachers
Mm,
to understand that there will be different types of students in the schools
yeah,
and different scenarios that they may have to deal with. So yes, that is the most important part there.
yeah. Okay. And like looking forward, how do you see the understanding of autism in the next few years like evolve, with like the emergence of artificial intelligence and new technology, and even apart from that, just how do you see it like changing or evolving?
So I think we're learning more and more about the diagnosis. We're learning its genetic
Mm-hmm.
roots and sources. We're learning about we're clearing up some misconceptions. Some people think that it's because of vaccines.
Mm.
So we're having to battle that in the medical world, and other misconceptions as well. So we there, I think it's definitely evolving. And like I was saying, it's becoming more commonly diagnosed because we have better tools
Yeah.
to diagnose it. So I think it's headed in the right direction. With AI involved, I think for somebody who has autism, I think AI is a great tool. Sometimes they may not feel comfortable asking a certain question
Mm-hmm.
to, a family member or a friend or something. And, things like ChatGPT can really kind of help maybe explain it in a better way,
Yeah.
for example. But also, there's a lot of new gadgets. Uh, uh, Now, I don't know specifics, but I can envision like some type of earpiece or a headset or something that can help maybe block out certain sounds or help calm down sensory things, or
Yeah.
or even convert loud sounds to something different that's more pleasant and will allow the person to continue to function, or just be able to help if there's a speech impediment or speech issues, to be able to help that person communicate with the rest of the world
Mm-hmm.
what exactly they're wanting to say. I think these are all positives and heading in the right direction.
Yeah. Okay. And then last question. Aside from autism spectrum disorder, or maybe this plays a part in it, what inspired you to work in the field of psychiatry?
So for me specifically, so I was in medical school already.
Mm-hmm.
Well, maybe it was before medical school and during medical school, and even just recently. So I'm originally from Chicago, where there's a lot of issues with substance abuse. And when I was leaving Chicago, this was back in the early 2000s, to go to school.
Uh-huh.
At that time, addiction was a big issue, especially in our community. So, actually, when I went to school, I would these are people that I grew up with, just playing video games with, playing Nintendo back in the day,
Mm-hmm.
watching movies with them and stuff. But then they kind of took a different path in life. But while I was in med school, I actually lost a really close friend of mine who ended up overdosing. He was from a very prominent family. No one knew that it was this bad.
Yeah.
And so when I heard about that, it was really shocking. And that kind of guided me towards the direction. Initially, I wanted to do addiction psychiatry, but then when I got into psychiatry, I realized that that's actually a part of all of it. So I didn't actually need to specialize in that.
Yeah.
It was just part of my day-to-day life of treating people. So that's what led me to the world of psychiatry. That also, I really is just fascinated by all these diagnoses that don't, I can't look at somebody's labs and say, okay, this person is bipolar, this person is
Yeah.
schizophrenia. There's no markers for that. I can't say, somebody like a cardiologist or somebody can look at somebody's cholesterol and say, okay, this person needs to be on this medication. I don't have that. So I actually have to talk to the patient, talk to their families, and I can figure out what the diagnosis is and use that. So everyone has a story, and I love learning their stories, and I love being able to treat them and watching them get better day by day.
Okay. Thank you for sharing that. Thank you for coming on and enlightening us about autism and just in general. And yeah, thank you very much.
Yes, thank you for having me on, and I hope to do this again soon.
Awesome. Great.